Hi, I'm Leonard and I'm here to talk about obsessive compulsive disorder. Obsessive compulsive disorder is a type of anxiety disorder characterized by just stressing repetitive thoughts, impulses, or images. These thoughts, impulses, and images are frightening, unusual, and absurd. Obsessive compulsive disorder is also referred to as OCD and the disease of doubt. According to DesignThinking.com, approximately 2.3% of the population between ages 18 and 54 suffer from OCD. The current numbers in the U.S. are approximately 3.3 million people that suffer from OCD of all ages. Almost 1 out of every 40 people will suffer from it at some point in their life. It could be both obsessions and compulsions, or one of them. I have been interested in knowing what exactly OCD is for a few years now. The main reason that I have wanted to know about it is because I've thought for a while now that I might have OCD. Have any of you ever thought that you or someone you know might have it?
Yes.
Well, today I'm going to inform you about the symptoms, causes, and treatments for obsessive compulsive disorder. I personally believe that it is most important to know the symptoms of OCD because there are many people that have it and do not know. Most people believe that OCD is just people that have to have everything organized and clean. However, that's not true. Since I believe the symptoms are the most important thing to know about OCD, I am going to start off by informing you of them. People that suffer with OCD can have all kinds of different symptoms. In some cases are more severe than others. There are certain symptoms that are more common, and those are the ones that people suffer with, but everyone is different. People with OCD have uncontrollable, unwanted thoughts known as obsessions. If you have OCD, you usually know that your thoughts are irrational, but you cannot resist them. They also have repetitive, ritualized behaviors that they feel compelled to perform, which are known as compulsions. An example would be if someone is afraid of contamination, they might develop cleaning rituals. Common cases of OCD usually fall into 5 different categories. Hoarders, people that fear something bad will happen if they get rid of something. Checkers, which are people that repeatedly check things that they associate with harm or danger. Washers, which are people that are afraid of contamination. They usually have cleaning and hand washing compulsions. Doubters and sinners, people that are afraid that if everything is not done perfectly, then something terrible will happen and they will be punished. Counters and arrangers are people that are obsessed with order and symmetry. They could also have superstitions of certain numbers, arrangements, and colors. Those are all the most important and obvious symptoms, but what causes them? There has been much research done on the cause of OCD, and there still is not an exact answer of what causes it. It is possible that there are different types of it. In particular, OCD that starts in childhood might be different than the one that starts in adulthood. Chemical and brain dysfunction seem to have something to do with OCD. Serotonin is a chemical messenger that is involved with biological processes such as mood, aggression, sleep, appetite, and pain, seems to be involved with the causes of OCD. It is not fully established if it is all or part of the serotonin chemical. Research suggests that communication between the orbital cortex and deeper structures like the thalamus are not functioning correctly. In other words, a circuit of inappropriate responses happen between these parts of the brain. Genetics can play a role in OCD, but it is not really common. An American study suggests that up to 30% of teenagers with OCD have an immediate family member that has it as well. OCD can occur from a throat infection. It can be temporary or not, however, it is not very common cause. The reason that it can cause OCD symptoms is because the body can confuse healthy cells with infection cells, which cause cellular damage. When that happens, the infection fighting system attacks the outside of the nerve cells in a specific part of the brain called the basal ganglia. The result of that is OCD symptoms. People with depression can develop OCD and vice versa. Now that you know the causes and symptoms of OCD, it is time to figure out how to treat it. Many people are misdiagnosed with other disorders such as ADHD and bipolar disorder. If diagnosed correctly, there are a few things that can help treat OCD. Antidepressants and a botanical medicine called St. John's wort can help, although they are not very effective without therapy as well. The most common and effective treatment for OCD is cognitive behavioral therapy. The biggest focus in therapy for OCD is to help teach people healthy and effective ways to respond to obsessive thoughts without resorting to compulsive behavior. There are many self-help tips to help with OCD. Some of those are refocus your attention, write down your obsessive thoughts or worries, anticipate OCD urges, create an OCD worry period, eat healthy and exercise regularly, practice relaxation techniques and get a good amount of sleep, avoid alcohol and nicotine. In conclusion, there is still a lot more research that needs to be done in the medical field concerning OCD, but with the information I've provided with you today, you should be able to have a better understanding of the most common symptoms, treatments, and causes of OCD. Thank you. Are there any questions?
What exactly is an OCD worry period?
Well, it's a designated time period that you allow yourself every day to succumb your OCD tendencies.